Have you ever noticed your shoulder becoming increasingly stiff over time? Maybe you're also dealing with severe pain that seems to come out of nowhere, making even the slightest of movements agonizing. If that sounds familiar, you might be dealing with adhesive capsulitis, better known as frozen shoulder. In this video, we're diving into this puzzling condition that still leaves researchers scratching their head. For such a bizarre condition that many people haven't even heard of, frozen shoulder is surprisingly common, affecting about 2 to 5% of the population. It tends to appear most often in people between the ages of 40 to 60, and it's more likely to affect women than men. Unfortunately, if you have diabetes, your chances of developing frozen shoulder are even higher, with around 10 to 20% of diabetic populations experiencing it at some point. Other factors like thyroid disease or a history of shoulder surgery or injury can also increase your risk. But despite how common frozen shoulder is, the exact cause remains somewhat of a mystery. Researchers are still trying to pinpoint why it happens. But what we do know is that when you look closer at the shoulder of someone who has it, there are some pretty unusual things going on that might explain the intense pain and stiffness. When it comes to the pain experienced in those with frozen shoulder, researchers think it might be due to an out-of-control inflammatory response. This isn't just the run-of-the-mill inflammation though. It's a specific type of inflammation called synovitis. Synovitis happens when the synovium, a thin tissue that lines the shoulder joint, becomes inflamed. Normally, the synovium produces a small amount of fluid that keeps the joint lubricated, allowing for smooth, pain-free movement. But when synovitis strikes, this process is completely disrupted, leading to swelling and severe pain, making even simple movements feel excruciating. This persistent pain is a major factor in why frozen shoulder can be tough to manage. And here's where things get even more interesting. Some experts believe that it's not just inflammation causing problems. Researchers have also seen evidence of new nerve growth in the shoulder's ligaments, which could be a big reason why pain can be so intense, even when you're just sitting still and not moving the shoulder at all. So the extra nerves might be amplifying the pain, and the reason why this condition can be so uncomfortable. But pain isn't the only symptom. Stiffness is actually the main hallmark sign of frozen shoulder, because researchers also see an increase in blood vessel growth in the affected shoulder, a process called angiogenesis. As new blood vessels form, they supply the area with more blood. While this might seem helpful, the increased blood flow and new vessel formation exacerbates the inflammatory process, making the capsule thicker and more rigid. You see, the body normally heals by producing collagen, a protein that helps repair tissue. But in frozen shoulder, this process goes into overdrive, causing too much collagen to build up. This excess in collagen leads to fibrosis, where the joint capsule thickens and forms scar tissue. As the capsule tightens, it reduces the space in the joint, making movement painful and difficult. This cycle of stiffness and pain is what freezes the shoulder, leaving it stuck and uncomfortable. Why this happens isn't fully understood, but factors like diabetes or hormonal changes might play a role in making the body more prone to this excessive healing response. Want to know how to figure out if you have frozen shoulder? Well, check out this next video where we review key signs and symptoms of the condition. If you found value from this video, don't forget to give it a like and make sure to subscribe to the channel so you can learn more about your body, how it works, and what it needs to keep moving.